Jersey City Medical Center has had a long history of an outstanding orthopedic program here, serving Jersey City and Hudson County. Now, with the addition of Kale Orthopedics as part of Jersey City Medical Center and an additional investment in robotic surgery, that pushes the envelope to a whole new different level. These are exciting times in Hudson County and at Jersey City Medical Center. Our orthopedic program, which is already outstanding, is now getting the addition of the best of the best. Kale Orthopedic Center, now in partnership with RWJ Barnabas Health and here at Jersey City Medical Center, doing the most advanced robotic surgery there is. No longer one has to travel across the Hudson to New York City or anywhere else for that matter to receive the best. It's right here with a specially trained team of nurses and physical therapists and everyone who supports the outstanding surgeons of Kale Orthopedics.
So when we do the robotic surgery, the first thing that we do is before the procedure, we get a CT scan that gives us 3 dimensions of the patient anatomy. So we can customize the implants to the patient anatomy. So when we are planning for the procedure, the first thing that we do is that we're able to put the cup in the right position for this patient, for what he needs. We're not removing too much bone. We're not making a cup that is too proud, that is too big, that is too small, that is in the perfect position to where the patient needs are. And when you talk to mainly orthopedic surgeons, the biggest challenge of hip replacement has been always the cup. I think that now with robotics, the cup has become a much easier part of the procedure, where surgeons can feel more comfortable doing it and making sure that the implant is in the adequate position. The second thing is the mechanics of the hip. And when we're talking to patients, I think one of my goals, and robotic has been able to achieve that, is that patients, after 3 or 6 months, they forget that they have a replacement, that we can restore the biomechanics of the hip to the point that they feel that's their own hip. And when you are doing the procedure, you can know if the leg is too long, is too short, if the tension in the muscles is too much. A lot of times the patients complain the leg is too long, the leg is too short, I feel that hip is so tight. With the robotics, we get live information that let us know where are we compared to the other side, where are we compared to where we started. And with all that information that we get live, we can really modify the implants that we're using to reproduce that. And I think that that's the biggest impact in my practice with robotics, is that I have been able to have amazing precision of the positioning of the implants, of the balancing of the soft tissues, where patients are coming back to the office and they forget that they have a replacement. And that's the end goal for us using robotics.
Yeah.
It's better than eyeballing it,
Right.
If I'm eyeballing it, it's not going to be as precise as external 130. And it's all the way to 130. We're going to go down with the leg, that then go all the way down. I think she's got that builder because
Okay, timeout. This is consented for right total hip arthroplasty, robot assisted using MAKO system. No known allergies.
Very long.
That tiny little bit I was talking about, you're at internal 15. I want that. That's going to be the first broach. Yeah. Okay.